Hi, welcome to our NORA Symposium. I am Marizan Ramirez, and I direct the Midwest Center for Occupational Health and Safety out of the Division of Environmental Health Sciences here in our School of Public Health. Just want to start off with a few words. Every man and woman in the nation has a right to a safe and healthful working conditions and to preserve our human resource. And this is really a mission of the Centers for Disease Control and Prevention. Since the 1970s, the National Institute of Occupational Safety and Health has functioned as the federal research agency within CDC committed to creating healthy workplaces for over 155 million workers in our country. Being healthy ultimately means protecting both the physical and psychological wellness of our country's workers. So each year, our division, in collaboration with UMASH, which is the Upper Midwest Agricultural Safety and Health Center, together with MCOSH, we hold a symposium dedicated to the topic of occupational injuries and illness prevention. We've been holding this NORA Symposium for over a decade now. And so what does NORA stand for? It stands for the National Occupational Research Agenda, which is a framework that CDC in our country uses to focus our research and prevention efforts. This year, we chose to focus on mental health. And why do we care about mental health? Our country is facing a mental health crisis, and workplaces can be a source of stress. Over a third of workers in the U.S. report that their jobs are either often or always stressful. But at the same time, workplaces can be a place where mental health wellness interventions can be implemented. So let me tell you a little bit about our center, the Midwest Center for Occupational Health and Safety. We are one of 18 centers funded by the Centers for Disease Control and Prevention, focused on training our next generation of occupational health professionals to tackle the most pressing occupational health issues of our country. Our center just celebrated 40 years of existence, and as we move forward, we hope to inspire our next generation of professionals to tackle the issue of workplace safety, and particularly workplace stress. So speaking of inspirations, I would just like to take a few minutes to commemorate one incredible inspiration to the field of occupational health and safety. Dr. Susan Gerberick, if she doesn't mind standing and coming to the front. She has dedicated her life really to the area of occupational injury prevention and research. She was our director. She directed our center for 12 years, from 2007 to 2019, and has organized perhaps very many NORA symposia in the past. She is still currently directing our occupational injury prevention research training program of our center. And she also, she's an inspiration to me. She brought me here to this place, and she has promised to mentor me in this position. So I have big shoes to fill, and I thank her for all that she's done. She has had a stellar career, has tackled topics of concussion in sports, violence to teachers and healthcare workers, and workplace safety to janitors. Please, Sue, accept this small token of our thanks for your service and leadership to our field.
Good afternoon. My name is Bruce Alexander. I'm the professor of environmental health sciences and head of the Division of Environmental Health Sciences, and also the director of the Upper Midwest Agricultural Safety and Health Center. And I want to welcome you on behalf of not only the center, but the division and also the School of Public Health of the University of Minnesota. And before we get going into our program, I do want to recognize a number of people that made this whole symposium happen and really helped pull us off. So Andy Ryan, who's a specialist with loon calls, and Joy Archibald is not only a photographer but does all the great web work. Chris Western, Diane Campa, Carol Peterson, Shelley Ring, Molly O'Brien, Frank Strand, and Deb Grove all did an enormous amount of work to put this together, so we definitely appreciate that. Now, if you've been checking the news at all in the last couple of years, you recognize that there's a lot of problems around mental health, and particularly mental health in agriculture, and that got our center particularly interested in it, recognizing that mental health and stress in farmers, farm workers and their families, is one of the most pressing health issues facing agriculture today. And we, about a year ago, started to make that a bit of a priority, and we were able to hold a forum, and we've had a couple of spin-off projects, partnership projects. One of them is you'll hear about a little bit about today from one of our panelists, Doris Mold, who in collaboration with Megan Roberts has developed this webinar series on cultivating resiliency and directed at helping women in agriculture. And it's those types of activities are incredibly important in agriculture and other occupations, because there's a lot of occupations that end up with stress being a major determinant of the health of the worker. And while mental health is sometimes viewed as more of a condition of character, it's every bit as much a biologically based disease, just like asthma, cancer, or injury as well. And so when we want to think about this as the consequences of their work causing some sort of stress and mental health condition, that is an occupational condition. And we're very fortunate today to have three panelists that will present this in three different types of occupations, and we'll have a chance for a panel discussion. And so with that, I would like to introduce our first speaker today, who is Doris Mold, and I'll briefly introduce her, and you can look on the website for her complete bio. But Doris is currently the president of Sunrise Agricultural Associates, and it's an agricultural consulting business that really, the way I interpret it is Doris, not only is she a farmer, but she is a broad-based advocate for everything that has to do with farming, whether it be business to sustainability and all the way to mental health. And she is, as I said, currently she's working with Megan Roberts on our Cultivating Resiliency for Women in Agriculture partnership project with Upper Midwest Agricultural Safety and Health Center, and that has been an amazing project that has reached an incredible number of people around the country already. She is also the past president of American Agri-Women, which is the nation's largest coalition of women in agriculture. And through her leadership in that position, she's brought a lot of attention to the issues of mental health in the agricultural populations in this country, and has done a lot of work in there. So I'll have Doris come up now.
I suppose you're wondering why I've got a canned ham. Well, you'll find out in a few minutes. I'm pleased to be with you this afternoon and humbled to be asked to represent agriculture in this forum. Like many women in agriculture, I wear a lot of different hats, and this is not uncommon. And you can see the long list of things that I've included here, the things that I do. I've worked in agriculture pretty much my entire life. I grew up on a farm. I've worked professionally in agriculture, and as a graduate student, I studied farmer-lender mediation in the 1980s. And somehow I've become one of the farm stress women. Megan and I have certainly had our hands full there. I'd like to talk a little bit today about, perhaps how farming or agriculture might be a little unique. I know that we all suffer stress in our occupations from time to time, but there are certain things that have to do, especially when you are a farmer and you live where you work, first of all. You never get away from it. You work with your family, which can be a great thing, but also can be a challenging thing because and there are multiple generations often involved. Definitely a tie to the land, which is a really important thing. But if you think about why people came to this country in the first place, for many people they were fleeing religious persecution, and they also wanted land because there was not enough land from where they came from. And so that tie to the land is really critical to that culture. There's a lot of isolation with agriculture as well. You might be working every day and not see another person outside of family members. And it certainly is difficult to get away. On my family farm, my husband and I have a small farm, and if I'm here, he's not with me. And we never have, since we started farming, we have never taken a vacation together. We've never left the farm together, outside of maybe a few hours. And there is certainly a culture that is associated with farming, that you keep a stiff upper lip, you don't talk about your worries, you don't talk about stress, you certainly don't talk about mental health. And as one person said to me yesterday, you're really, carrying the weight of your heritage in those generations on your shoulders, because there is this expectation that you are going to follow that 11th commandment, that thou shalt farm, and that you cannot let all of the previous generations down. And especially for people that have worked the land and improved the land over the years and have worked with livestock. For instance, I have a dairy farm, and you've had generations of family members working on breeding the best cows. And if you're the one that decides you're no longer going to be a dairy farmer and you send the cows down the road, that's it. Your legacy in a lot of cases is snuffed out. And so it is not just a job, it is people's lives. And we're not just food producers, but we've been brought up to believe that we feed the world. And we do, truly. If you look at the proportion of people involved in agriculture, involved in farming in this country, you've got 1.5% of the people raising all of your food. And the stress is always there. Stress is, heightened right now because we've got financial stress, but there's always stress, and you can read the long list of all the different stressors. But there's a lot of things that are out there that cause stress to farmers. And one of the things that we decided to do, rather than just focus on the stress, Megan and I, as Bruce mentioned, Megan Roberts and I decided that we wanted to try to do something about it. And so we decided to work on a cultivating resiliency project and focus in on women and their stressors, because women really are the ones that keep the farm going. And they're the ones that people come to the concerns. And I'm not saying the men aren't important, but women are juggling those many different projects. And they are in charge of not only farming, but they might have an off-farm job. They are probably taking care of elders. They're maybe taking care of children. They're juggling a lot of different things. And we found that 90% of the participants in our questionnaire, which just closed on Tuesday, they identified agricultural stress. Now, you heard the figure earlier, what was about a third of people feel stress from their job? Well, we're finding that 90% of the people are feeling stress from their job. So it's pretty critical about what people are seeing. And I noticed that these are my old slides, so we don't have my updated ones. So I'll go, some of the numbers have changed a little bit, especially on work hours and things like that. But here are some of the work hours that people are reporting. But we had people reporting 106 hours on average a week, over 15 hours a day. In 2016, I looked at farm business management instructors and interviewed them, and 82% of them said that the farmers that they worked with were suffering a lot of stress. Subsequently, I interviewed them this last year, and there's a longer list. A higher percentage are feeling stressed, and they're feeling stressed in many different ways. So it has... So these aren't people that are farming, but these are people that work with farmers every day, and they're working with quite good farmers. And they're finding the stress levels are increasing. If you look at Chapter 12 bankruptcies, especially in the Midwest, in the middle part of the country, they are going up considerably. And Chapter 12, I won't get into the intricacies of why you're not seeing it so much in other parts of the country, but part of it has to do with the fact that Chapter 12 is for a certain size of farm. It's for more of the mid-sized farm. So larger farms wouldn't be included in this number, nor would smaller operations. Median farm income, if you look at median farm income, this again is from Farm Business Management data from Minnesota, and you can see over time that it was fairly low, and then it spiked for a while, and that was when corn and soybean prices were quite high, so this would be for all farms in Minnesota. So this gives you a little idea of kind of where the finances are at for the state of agriculture in Minnesota. But I think one thing is really kind of striking as you look at the finances. The median income for a Minnesota household in 2017 was $68,000. The median income for a Minnesota farm was $28,000. And if you look at the poverty level for a family of 4 in 2016, which was the most recent figures available, it was $24,000. So the median farm is operating at close to poverty level. And when you look at income from, again, these farms that participate in the database, these are the most recent numbers. It's the lowest income that we've seen in 23 years from when they started collecting data. And if you look at dairy farmers, for instance, which is what I do, the median income was $14,697. So you look at that and you're saying, okay, well, that's what they use, that's their pay for the year. So all their family living comes out of that. Any reinvestment that has to happen for the farm comes out of that. So if they need new milk machines, if they need new farm equipment, it has to come out of that $14,000. And those are some really striking numbers. And if you look at the bottom 20% there, they had an average loss of $72,000. And I put this, the ghost of the 80s return. As I said, I studied farmer-lender mediation, and looking at the data, they didn't have as good of data back in the 80s as they do now, but they're really seeing that these numbers are looking like we started to see in the 1980s, which is frightening. Because for those of you that might not be aware, 80s were a really difficult time, and we saw a lot of farmer suicides and a lot of challenges there, and a lot of people left farming. And we see farmers streaming out. And we see that there are challenges to getting help. Not only is it the culture, it's cost and availability. There aren't mental health providers in a lot of places out there in the country. And if they are available, sometimes they're in a very visible location. So you're not going to drive up to the shrink who's right next to the most popular coffee shop in town, because there's a stigma, hey, Joe's hopping out of his truck and coming. Oh, no, he's going over to the shrink. What's going on there? And so the availability, when there is somebody available to talk to, is sometimes in a very visible location, and there's certainly a stigma with that. But there's also a big problem in that a lot of farmers don't have health insurance. Especially with the Affordable Health Care Act, people were touting was a really wonderful thing, and for some people it was. But for small business people, it priced them out of insurance. And in many cases, in the case of dairy farmers in particular, when both family members on a small dairy farm have to work on the farm to get the chores done, they found that 41% of dairy farms in the United States did not have health insurance. So how are you going to pay for these things too? So do you know what this is? Any guesses? A lot of different food items, right? Well, the food items represent a charity box that were dropped off to farmers in my area. Now imagine yourself. Your career, your job is to produce food for the world. And your non-farming neighbors don't believe that you have enough money to pay for food for your family. Think about that. If you think about, your generations of families have been working hard to provide food for you and for their own family, and you've got neighbors thinking, well, you can't afford it. So that's why I've got the canned ham up here, because the canned ham represents, you'll see it, it's about the center of that picture. Farmers are really proud people on top of everything. Maybe their pride gets in their way a little too much. But this is kind of the last straw. Imagine that you're a pork producer and somebody's giving you a canned ham. And that's where we're at, folks. It's tough. It really is. But I'm not here to sit and lament about what is going wrong. Megan and I are doers, as are a lot of people in agriculture. We're problem solvers. One of the things that we came up with when we had the opportunity through UMash was to come up with a project to try to help people. And we started a Cultivating Resiliency project, and we focused on women in agriculture. And we're certainly not ignoring stress in everyone, but we found that women are often not considered, and that they have slightly different needs when it comes to farm stress because of their multiple roles, and that women's mental health and psychological well-being is often under-researched. So hence we did the questionnaire, which you had the previous slides, but then we also did some other parts of the project as well. So the first phase was funded by UMash, and then this has been a joint project between American Agri-Women District 11, University of Minnesota, Women in Ag Network, and it's consisted of these online sessions that we've done, a national questionnaire, which I alluded to earlier, and 2 live sessions. And our session participants ranged in age. We did have men participate as well, but the majority were women between 23 and 72 years of age. Pretty much every type of ag career was included, every size of farm was included, and we had pretty much every type of product that farmers could raise, and small to large family farms. We reached 36 states and provinces. 3 Canadian provinces participated as well. And we really looked at how we could strengthen people and work on issues related to mental health. And we found that people were really positive and really connected with what we're doing, so much so that we have a suicide prevention session that will be held next Friday, May 10th, and you can sign up on the UMash website. And in addition to that, we have an expanded national program with online sessions, podcasts, coffee chats, mental health first aid, and additional things that we're going to be doing that have been identified. One thing that I wanted to leave you with is that I have these little cards that are made up and they're handed out. And I did have a slide about this, but like I said, we've got a slightly different slide deck. But I think that this is important. This is kind of my take from after participating and working on this project. I think it's really important that we recognize the issues that we have, but that we also recognize the really good things that are going on in our lives. Because I love agriculture. That first slide that you saw when I came up was from my farm. And that's what I get to enjoy and try to focus on that. But one side of my card says, I am stronger than this, and this can be used, any one of you can use this, whatever you're stronger than, whether it's a stressful job, a pain in the butt boss, bullies at school, whatever it is. Or maybe it's just, you can't handle doing any more housework, or whatever your stressors are. And the flip side of it is also 3 things that you're grateful for. What we've been doing every night when we sit down to dinner, you can't leave the dinner table until you say 3 things that you're grateful for today. And so that's what keeps me going. That keeps me, I recognize the stress that we have. And we have a lot of it. I have a husband that has a brain tumor, and he has stress and anxiety and depression, and he's a farmer. I'm a farmer, and this is what we do to get ourselves through. So I thank you for your attention, and I look forward to the panel discussion.
Okay, next, I'm very pleased to introduce Stacey Holzbauer, who Stacey actually also grew up on a farm, cattle farm in South Dakota, and became a veterinarian and got her MPH at this small college down in Iowa. I forget what it's called. That's okay. But after she got her MPH, she went on to be an epidemic intelligence officer with the CDC and was stationed in Minnesota. And she's been here on assignment from CDC since then, and runs a number of different programs at the Minnesota Department of Health, primarily related to infectious disease, although she does have an occupational history in her work when she was one of the people that investigated the porcine-induced peripheral neuropathy outbreak out in pork processors. But as one of the projects she did in her passion for healthy people and veterinarians, she investigated the well-being of with colleagues at NIOSH and others at the Minnesota Department of Health and around the country, well-being of veterinarians, particularly with respect to stress and mental health. And so very pleased to have Stacey Holzbauer with us today.
Thank you, Bruce, and it's a pleasure to be here with you all. And I have to say that talk that we just heard literally brought tears to my eyes, because I have I come from a family of farmers and teachers, and so I totally understand what you're going through. And so I want to say before I start, all the credit for the slides that I'm going to go through really belong with Dr. Randy Nett, who is a physician and married to a veterinarian, and Dr. Suzanne Tomasi, who are both with NIOSH, and after that initial survey that we did, have really carried this torch of continuing to look at veterinary suicide risk. So I want to make sure that they get all the credit for the slides that I'm going to present here. So first question is, why are we here? Talking about veterinary issues. I think an article that was published in JAVMA in November of 2013 really served to kind of turn the veterinary community's attention to a problem that was familiar to far too many veterinarians. Many of us knew at that time at least one colleague or a classmate who had died from suicide, but it was never talked about. And what might have also contributed to this increased awareness was some very high-profile veterinary suicides that made it into the national news. Perhaps the most well-known was Dr. Sophia Yin, who is a well-known behaviorist who committed suicide in 2014. And so the question became, what are the numbers of suicides in the veterinary profession, and are they increasing, and who's at highest risk, and what can we do to help these individuals? So let's first look at what we knew from past data. So just to briefly talk about suicides, there's more than 41,000 deaths from suicide in the United States in 2013, and there's actually more recent data on this, making it the 10th leading cause of death. Suicide is 3 to 4 times more common among males, and it's likely underrecognized and underreported. And risk factors for suicide include depression, serious mental illness, suicidal ideation, and psychosocial difficulties at work. And whites are more likely than non-whites to die from suicide. And so suicide mortality among U.S. veterinarians has been previously studied. There was an all-cause mortality analysis published in 1982 that studied approximately 5,000 veterinarians who died during a 30-year period from 1947 to 1977. This study identified veterinary decedents among the AVMA, which is the American Veterinary Medical Association's obituary listings in their journal. And then the investigators then looked at causes of death from death certificates from state death certificate data. And at that time, this study showed that veterinarians had a proportionate mortality that was 1.7 times that of the general U.S. population. And so this study already provided important mortality information for the veterinary profession, but it only included white males, and 88% of them specialized in production animals, such as cows, pigs, horses, sheep, and goats. However, the veterinary demographics have changed, and now the profession is comprised predominantly of females who specialize in companion animals, and the current veterinary school population is over 80% female. So the number of female veterinarians are continuing to rise. In 2014, I was lucky enough to help establish a U.S. national veterinary survey looking at veterinary mental health stressors and suicide-related risks. We were able to enroll over 11,000 veterinarians who were included in this analysis. 31% of them were male, 64% were small animal practitioners, and almost half of them were from 30 to 48 years of age. In this study, we found that 1 in 6 had considered suicide since they started practice. So let's briefly take a closer look at this data from this national survey. So here are the risk factors for suicide showing on the x-axis, which include current serious psychological distress, previous depressive episodes, previous diagnosis of depression, previous suicidal ideation, and previous suicide attempts. Male veterinarians are shown in blue. Female veterinarians are shown in orange. And U.S. adult males, for comparison, are shown in blue with the hashtags, and U.S. adult females are shown in orange with hashtags. Both male and female veterinarians had a higher prevalence of current serious psychological distress compared with the U.S. population. Similarly, male and female veterinarians were more likely than U.S. adult males and females, respectively, to report previous depressive episodes and previous diagnosis of depression. Male and female veterinarians were also more likely to consider suicide compared to the U.S. general population. And similar to the U.S. population, more female veterinarians than male veterinarians reported previous suicidal ideation. However, male and female veterinarians were less likely to report previous suicide attempts compared to the U.S. general population. So on the surface, you may think that this is a good thing. However, what it likely means is that veterinarians who attempt suicide are unfortunately successful in their attempts. This figure looks at the perceived stigma against mental health illness, which is also a risk factor for suicide because it prevents the individual from seeking care. Veterinarians with serious psychological distress are shown in the blue boxes, and veterinarians without serious psychological distress are shown in green. And adults with serious psychological distress are shown in the blue hatched boxes, and U.S. adults without serious psychological distress are shown in the green with hatched boxes. We see that veterinarians both with and without serious psychological distress had greater perceived stigma against those with mental illness compared to U.S. adults. In fact, only 15% of veterinarians with serious psychological distress somewhat or strongly agreed that people are caring towards persons with mental illness. During that national survey, we received over 1,400 written responses. We had a graduate student from the University of Georgia who undertook the analysis of those written responses, and those findings were also published in JAVMA. In that analysis, the most common practice-related stressors that were identified included financial insecurity, client issues, coworker interpersonal issues, and work-life balance. In 2018, a Merck-sponsored study also was published looking at veterinary well-being. Overall, the well-being was similar to the U.S. population. However, younger vets and female vets scored significantly lower than the general population. And employee assistant programs under which employees could receive treatment for mental illnesses were rare. And this study also agreed with the previous stigma finding. So now I'd like to focus on a project that Suzanne Thomasy has been working on at NIOSH. And so we had the previous mortality study that was done from 1947 to 77. And so the question then is, what are the recent trends for suicide mortality among U.S. veterinarians? So the objectives of this study were to compare suicide mortality in U.S. male and for the first time U.S. female veterinarians with the general population, describe suicide mortality patterns by occupational characteristics, and described suicide mortality trends during the study period. And so this study utilized AVMA databases along with CDC vital statistics data. The AVMA, through their database of obituary records and life insurance policies, were able to provide demographic data, which were then linked to vital statistics data that listed the underlying cause of death. Unfortunately, we were not able to determine a denominator for the veterinary population during the study time period, so proportional mortality ratios using the life table analysis system were used. These were standardized by age, sex, race, and period, and a PMR greater than 1 indicated a suicide mortality higher than the U.S. population. They analyzed over 11,620 decedents. A total of 398, or 3%, had deaths that were attributed to suicide. Among those, 82% of the suicides occurred among males and 18% among females. The median age for males was 57 years, and the median age for females was 42 years. The majority of males and females who completed suicide were working in clinical positions. 75% of the decedents with a known species specialization worked exclusively or predominantly with companion animals. Both male and female veterinarians had significantly higher proportionate mortality from suicide than the general U.S. population. Males were 2.1 times as likely, and females 3.5 times as likely to die from suicide than the general U.S. population. For species specialization, male veterinarians who specialized in companion animals were 2.7 times, and male veterinarians who specialized in food animals were 1.7 times as likely to die from suicide than the general U.S. population. Female veterinarians who specialized in companion animals were 3.4 times, and female veterinarians who specialized in food animals were 4.9 times as likely to die from suicide than the U.S. general population. This figure displays the number of suicides by sex for each period. During the study period, the number of male suicides, represented in blue, varied among periods. However, the number of female suicide, represented in orange, steadily increased for each period. By analyzing the codes of death certificates, they were able to determine the method of suicides for decedents. When we compare methods of suicide between the U.S. general population and veterinarians, there were notable differences. In the general population, firearms is the most commonly used method. In this study population, firearms were still the most commonly used method, but poisonings were higher than the general population. Again, there were also some notable differences between male and female veterinarians. 51% of male veterinarians used firearms and 32% used poisonings, compared to 18% of female vets who used firearms and 64% of females who used poisonings. The reason for high proportionate mortality from suicide among U.S. veterinarians is likely multifactorial and includes the following: demands of practice, such as long work hours and work overload, practice management responsibilities, client expectations and complaints, a knowledge of euthanasia procedures and training to view euthanasia as normal and an acceptable method of relieving suffering, ever-increasing educational debt-to-income ratio, poor work-life balance, and finally, veterinarians have access to controlled substances like euthanasia solution and pharmacological training to be able to calculate a lethal dose. So to summarize, we found a high prevalence of risk factors for suicide than the general population, a higher proportionate mortality from suicide than the general population, and a higher suicide mortality that extended from 1979 to 2015. And there were multiple work-related stressors leading to this. Our research indicates that there's clearly a need to reduce the excessive risk of suicide among male and female veterinarians. While our study cannot correlate suicide mortality as an occupational hazard, the hierarchy of controls that are as commonly used by NIOSH may serve as a framework to make recommendations for occupational health. For suicide, administrative controls may be the most likely. For example, we can schedule shorter work hours or make the access to euthanasia solution restricted. However, we also need strategies outside the clinic. So supportive strategies could include applying evidence-based suicide prevention strategies, improving U.S. veterinary awareness of availability of suicide prevention resources, collaborating among multiple stakeholders to implement suicide prevention strategies across a wide spectrum of practices, and using data to evaluate suicide activities. Many of us veterinarians dreamt of becoming a veterinarian since we were a young child. Now we need to work to make it so our childhood dreams live up to their expectations to be the safest veterinary practice experience possible. And we all continue to enjoy the profession we choose, as well as make that profession for future generations that they want to join. Thank you.
Very pleased now to bring to the podium Joe Meuwissen, who is a retired deputy chief from the Bloomington Fire Department. And not only is Joe a retired firefighter, he has also had quite a career as a school psychologist He received his bachelor's and master's degree in psychology from Morehead State University, and did postgraduate work at Virginia Tech, where he became a certified school psychologist and a licensed independent clinical social worker. And he spent 20 years serving with the Bloomington Fire Department, retiring in 2007, and is chief of training. And he's also been active in the Metro Critical Incident Stress Management Program since 2003, and on the executive board of the Minnesota Firefighter Initiative. And this is rounding out our suite of a couple of occupations where stress is particularly apparent, and also an area of work for Professor Hyun Kim in our division in the Midwest Center, and recognizing the importance of stress and other factors in this other very vital population. Joe.
Well, good afternoon. You made me nervous there. I was afraid I was going to have to do a tap dance for 15 minutes when you couldn't get the PowerPoint up. Again, it's a pleasure. I thank the Center for inviting me to be a part of this conversation this afternoon. Fire service was a great part of my life. I did 20 years. It's one of those things you never realize what you had until you're out of it, kind of thing. I missed it dearly for the first year after I retired. Fortunately, my son had joined the fire department. I had the privilege of training him in my last year and his first year. So I still hear the pager going off at night. I still see the big red trucks floating around the neighborhood, and I'm still connected to the department in that sense. But truly, it's a wonderful, wonderful experience. However, it does come with some baggage. One of the things that we've discovered over the years is that there's a lot of occupational death associated with the fire service. The initiative that I'm part of right now is through the MinFire initiative. We're starting to understand the impact that the fire service has on cancer rates, on cardiac impairments, death by cardiac arrest, and also now the secret is out. We're discovering more about suicide in the fire service. The unfortunate thing is we don't have good data, and so unlike my colleague here with the veterinaries, I don't have those kinds of statistics because they don't exist yet. But I wanted to talk today a little bit about the fire service. Who we are, what is the fire service all about? People think, okay, yeah, those are the guys that come and squirt water and put out a fire. And you see it on the news, it's kind of the headline. It's a big wow moment. You see that kind of thing. But in reality, the fire service is quite a bit different. Let me go back here for just a second. So I want to talk about what is the fire service. I want to talk about the culture of the fire service. We're a very unique kind of world out there. And then we'll talk a little bit about the nature, how those cultural factors may impact our longevity in the fire service. Most people don't know it, but 71% of the fire service is actually volunteer in this country. Okay? Think about what other first responder in your community that you're aware of is a volunteer. Police officers don't volunteer. EMS aren't volunteers. There's a lot of misunderstanding maybe about what the fire service is about. If you look at what we do, it's more than just putting out fires. There's fire safety. We talk about fire prevention. There's the environmental piece with hazardous materials intervention. Some things are very specialized, like fireboats. Well, we do have some fireboats because we have the land of 11,000 lakes, right? So we've got to get out there and intervene in a water rescue, for example. When the bridge collapsed in Minneapolis, you might have remembered the picture of that Minneapolis fire captain who was she tied a rope around her waist and was going underwater trying to rescue victims. So we do see that. But we're also responsible for code protection, things like making buildings safe so that we can be safe in our homes as well as residences like multi-story residences, occupational assemblies like this, etc. As I said, 71% of the fire service in the United States is volunteer, but Minnesota has one of the highest percentages of volunteer firefighters. Ours is over 95% of the firefighters in this state of Minnesota are volunteer or paid on call. You think about, okay, what is the biggest thing that firefighters do? The chart, that light blue, is emergency medical service response. Over 60% of fire service response is related to the emergency medical services. Only 5% or less actually involves stretching a hose line and putting out the red stuff. So let's talk about the culture of the fire service. It's a paramilitary organization, okay? You got a chief, and you got, I was a deputy chief when I retired. You got station captains. You got people who are in charge at every level, on every scene, on every kind of experience. You've got a chain of command that you have to operate through. And sometimes there's the second side of that. Within your firehouse or your station, wherever you're assigned to, you have your own pecking order. It may be there is a red hat, a captain assigned to that station as the one in charge, but then you've got the real experts, the guys that have been around for quite a few years, and they'll tell you everything you need to know about how you're going to behave on the fire ground. Everybody's got a boss. You know, you know what that chain of command is, and that's important in emergency response. The thing that we got to understand is this is a team sport as opposed to other public safety things. Law enforcement officers, 90% of them, they're in a car by themselves, okay? Firefighters, we come in a big red truck, okay? You got 4 or 5, hopefully 4 or 5 that are going to be there to help you, take care of your responsibilities. For a typical structure fire, say Mrs. Smith's house is on fire, that typical fire response is going to be 3 engines, 3 ladder companies, a command officer, and maybe you'll have another utility vehicle or something like that. So you got 6 big rigs that are going to show up to help Mrs. Smith out, okay? Plus command structure to make sure that everybody goes home at night. That when you first join the fire service, you got a lot of training. You got to learn a lot of stuff, okay? And so that technical knowledge, the practical side of it, you learn the theory, but it's also a very physical, demanding career. And so you got to get out there and learn how to stretch hose. You got to learn how to climb ladders. You got to learn how to extricate people from vehicles. You're doing all of the physical labor. And while you're doing that, you're wearing personal protective equipment that weighs typically about 60 pounds. So, you know, the demands physically on you as well as the psychological demands, and we'll talk about how that impacts firefighters' lives. Career versus volleys, the volunteers. As I said, the vast majority of firefighters in this community, in this state, are volunteers. But you get to the big cities, Minneapolis, St. Paul, and Duluth, those are all career fire departments, okay? And they have their own unique situations that impact their performance as well and their psychological functioning. So what does it take to be a hose dragger? You got to be highly motivated. You're an action-oriented type of person. You're a risk taker. You know, you're running into the building when everybody else is going the other way, okay? You want to be a rescuer. You're good at taking control. You're very competitive. Just put 2 groups of firefighters in a particular environment, and they're going to try to outdo the other. I mean, it's just part of the nature of the way we are. The strengths of that personality, you're very efficient, good decision makers. You tend to be cool under fire because you got the knowledge. You know what you're going to be doing. What are your tactical objectives? What are you supposed to do in this particular situation? There's a loyalty. It's a brother and sisterhood in the greatest sense. and you're hardworking people. The problem with all of these factors is you tend to be overextended. You may work very hard to suppress or avoid emotion. There's that expectation when Mrs. Smith's house is on fire, you're going to put it out. You're going to do everything you can. Or when this person is having some kind of a cardiac event, you're going to save this individual. So there's a tremendous amount of pressure on the individual to perform. And we get pissed when we can't control the outcomes, I'll be frank. We risk a lot to save a lot. Okay? So this is a nice little collage of pictures here. The gentleman in the red hat, this is the MURA building explosion down in Oklahoma City. Okay? Terrorist event. And it blew up daycare. That was part of the struggle there. This was an iconic photograph. This other photograph right above me is baby Jessica. You might remember this one from Texas, where this little girl fell into a well. Okay, these two pictures are related in the most bizarre way. The gentleman that's holding that child was not the gentleman that rescued the child. He just literally picked her up from the person who was down in the well and who spent an hour and a half working her out of this well, carried her up, and handed her off to this gentleman who was part of the rescue team. I mean, a critical part of that team. He's the one that got the photograph, right? Pulitzer Prize photograph. The other guy, 4 days after Oklahoma City bombing, the rescuer killed himself because of post-traumatic stress related to the baby Jessica event. Okay? He was there was interviews, there was a movie made, all of this kind of stress related to Jessica's rescue overwhelmed him. Post-traumatic stress. The trigger event for his suicide came the day, and his comments were the fact that all of those rescuers at Oklahoma City were going to carry that with them the rest of their lives from that trauma and that carnage that they witnessed. We all remember our firsts. I remember my first house fire. I remember my first fatality fire. I remember my first auto extrication where the patients didn't make it. We remember them because they become a part of us. I talk about this when I do a lot of intervention with firefighters and law enforcement officers and EMS personnel through my work with the critical incident stress management team. You create a new normal. Okay? You didn't ask to come to this event. You did this because this is part of your workplace. Okay? You showed up, you did your work, and it had a toll on you. So now you got to put it to bed. You got to take it out of your minds because you go on to the next task. You don't have time necessarily to recover from this particular thing. So you create a new normal. Okay? I talked about it. I was a training officer back in the day. I didn't use this kind of tech. I didn't have this kind of technology. I had 35 millimeter slides and a slide tray. So my analogy is I got a slide tray full of stuff up here. Okay? And at some point in time, those slides will come back and they'll revisit me. My worst critical incident occurred on 494 at 34th Avenue. A mother and her two children were on their way to Valley Fair to celebrate the 13-year-old boy's birthday. They had a collision with a tanker truck. It basically killed the mother and the daughter in the back seat. The boy fortunately survived, but they were burned beyond recognition, and my job that day was to remove the bodies from the car. There's not a day when I drive down that road, I don't remember that incident. It doesn't bother me, but I remember it and I respect it because it's a part of me. Okay? And that's the thing that we deal with in the fire service, creating the new normal. Critical incidents, anything that involves personal harm. I remember one time I ran out of breathing air. Scared me to death, literally. I'm still here, I'm doing fine, but when the threat of personal harm, that's a critical incident. This next one it's 2 weeks ago, we had a little 5-year-old boy thrown over the balcony of the Mall of America. Those are the kinds of incidents. I debriefed those responders that went to that. That's the kind of moral injury that impacts fire service personnel and law enforcement and EMS. And, those people did an amazing job, but they're going to carry that one. That's going to be their critical incident that will become part of their slide tray. Other death of a coworker, unexpected death, they're all critical incidents and they all impact us. We take something away from them. Sometimes it's not our day. We come to work and we've got all sorts of things in our own personal lives that might elevate our stress levels. You think about it, a career firefighter goes to work, they work a 24-hour shift, they're off for 24, they go back to work for 24, and then they're off, for 3 days. A volunteer firefighter is on the clock 24 hours a day, 7 days a week, 365 days a year. The only time I, turned to my pager off was when I was out of town. Okay, so there, the impact is significant. Anyway, I'm being told it's time to knock it off. But anyway, I look forward to having a conversation with the other panelists in our discussion up here. And I thank you all for your attention and look forward to any questions you might have.
Okay, thank you very much. I realize we are all, including Maris and I, are running long, but I think these very powerful stories need to be told. And what I'd like to do now is invite all of our panelists up and our 2 discussants who I'll introduce, and we'll have a few questions from the audience. I'd first like to introduce, maybe you can come up as you come up, our 2 discussants with Josie Rudophi. Josie is an investigator at the National Farm Medicine Center. She got her PhD at the University of Iowa, and she is becoming one of the world leading specialists in mental health research related to agricultural populations, and she's been a real great contributor to the Upper Midwest Agricultural Safety and Health Center, as well as the National Farm Medicine Center's efforts in this area. And secondly, our own Pat McGovern, who is a professor of environmental health sciences and leads the Occupational Health Nursing Program, Occupational Health Services Research and Policy Program. And one of the reasons we brought Pat in to be the discussant in this is she led a project that UMass funded a couple of years ago doing follow-up with farmers and responders to the high-path avian influenza crisis that hit Minnesota turkey and egg chicken growers in 2015, and she learned an awful lot about work-induced stress and mental health. And so now I'd like to invite the rest of our panelists back up, and Pat and Josie will take over from here, and I'll slip to the back and hide back here and pick up questions that are typed in.
You commented on some of the barriers that agricultural producers face in seeking mental health care, and then talked a lot about sort of this national program that you're hoping to roll out. I was wondering if you could talk briefly about maybe 1 or 2 of the components of that project or that program and how you decided on those and feel as though they're appropriate for the population.
Okay. All right, well, thank you. There are a number of components, and as I said, both Megan and I live this pretty much on a daily basis. But we came up with the different ideas based off of some of the research that we've been doing with our questionnaire, as well as we do a post-survey for each of our online sessions as well. One of the things, because of the stigma, we are working on a session that we're calling coffee chats, and they're basically essentially a support kind of network or session, but you really can't in agriculture call something a support group and think that you're going to get a lot of people breaking down the doors to participate. So we are looking at both offering a face-to-face opportunity for people in different areas of the country, trying to get groups together, but we're also going to be doing virtual sessions as well, because people are isolated, and there are some parts of the country that they might not even have a connection with another farmer or rancher anywhere near them. We have people that are living on isolated farms and ranches, and they can't participate. And sometimes they can't participate. We say, well, go look at the video online or go look at this online. They don't even have good enough internet service to participate in some ways. So some of it will have to be telephone as well. So we're looking at that as one key area. We're going to continue the online sessions as well. And one thing that people might find a little strange that we're going to do with some women that are in agriculture, food is a very important component for all of our lives, right? So one of the things that people are working on is getting groups of women together. This may sound a little odd. We're not trying to turn people into Becky Homekis, but the thing is that women who are juggling multiple things want to get things done. So we're going to bring groups of women together and develop a model for how to do freezer meals in a group, but also use that as a stress reduction technique, that you get to talk, maybe have a glass of wine with other people that are in a similar situation. You get some 5 meals that are ready to go for harvest season, and you get an opportunity to talk with each other. And it's really important in that sense that you're not offering people free food, that they are paying something for it, but that they're an active participant in that whole process. And those are some of the things that we're looking at. But we've got a whole broad range of things that we're rolling out. So thank you.
So on that same note, I wanted to ask the two of you about prevention activities within your profession, because I had a nice opportunity to talk to both Stacey and Joe in preparation for this. And Joe, you had talked a little bit about the Minnesota Firefighters Initiative and work they're doing to support mental health. Can you talk a little bit about that?
MinFire started about 3 years ago when we started looking at data that talked about the impairment of cardiac function, the impairment of due to cancer, and we started to discover some of the data about firefighter suicide. And so ours is a 3-pronged effort to improve the occupational experience for all firefighters, whether they're volunteer or career. It's like any other initiative, though. When you're first starting out, where do you get your money? How do you fund it? And particularly when you think about it, a lot of volunteer fire departments can't afford it. They can't afford anything. They're doing bean feeds to buy equipment for their fire station. So we need some kind of state-level support for these kinds of initiatives.
And Stacey, I wanted to ask you, we talked a little bit about the Minnesota Veterinary Medical Association and some work that they're doing related to compassion fatigue. Can you tell us about that?
Sure, I'd be happy to. So the Minnesota Veterinary Medical Association created a new committee called We Give. It stands for Wellness and Gender Issues in Veterinary Medicine. And we had our first session at the annual Veterinary Medical Association meeting in February. And at that meeting, we addressed some of the gender issues associated with, say, large animal practice. And so we had a veterinarian from Texas who works at an all-female large animal veterinary clinic, and they actually have a daycare that they pay for as part of their clinic. And that's just a perk of the practice, which, as a mom myself, making sure that your kids are being well taken care of while you're at work is, obviously very important. We also had a licensed therapist who specialized in compassion fatigue, who talked and just kind of, opened it up to the participants, and there were essentially 2 overwhelming themes that we noticed from the veterinarians who attended. One, that veterinarians have no ability to assign boundaries, and 2, they struggle with clients themselves that are experiencing mental, acute mental health crisis because of, concern with their pets. And so what we're trying to do now is we're actually creating a list of licensed therapists who specialize in compassion fatigue on our website so that people can find them. And we're also planning to do psychological first aid training so that veterinarians can have some tools in their toolbox on how to handle these situations. And then another thing that we're doing, which we're actually stealing from you all, is having a situation or a meeting at the Arboretum, which is based off of the Women in Ag program, where we're going to have women essentially come and just talk about the stressors of practice and kind of forge again those relationships.
I have kind of a question for both Stacey and Doris then. So I'm working on some research. We're trying to figure out who to train and who to have as sort of a farmer's lifeline. And a lot of times we suggest maybe a veterinarian, because there's somebody who visits a farm pretty consistently, and they might be able to pick up on changes in an individual. But I mean, my thinking just in the last 20 minutes has shifted. Like, here's a population that also is probably struggling. And so I guess I would just ask both of you to maybe comment on either the egg producers or the veterinarians, maybe willing or capacity to serve as sort of that checkpoint for the other. Because I think we put the burden on the veterinarian to be, again, sort of that person on the farm, but they certainly have their own struggles to deal with.
Well, I think you hit on a very good point, and one of the things is that I'm going to say that it isn't just farmers that are suffering. When it's people, there's a cascade effect throughout agriculture, and so our veterinarians, we know, are suffering. Part of it is, you had the financial stress slide. Well, we're part of that reason because we can't pay our vet bill, and that sets up a stressful situation too, the client relationship as well. And then with other people, and I think really what we have to look at is not just look at how we can support farmers or how we can support veterinarians, but how do we support each other? And how do we grow that community and that compassion? And everybody's got different capacity to do that. Because I know in our relationship with our veterinarian, we exchange. Our veterinarian actually had a son who developed cancer, and they had major issues. And we ended up supporting them and doing things to help them out. And I think we really have to look at how we can do things together rather than saying my veterinarian's going to support me or I'm going to support my veterinarian. How can we develop things in communities that we're all just caring for each other a bit more and paying attention to those things that might be signaling that not everything's okay?
Ditto. I think, yeah, if we see it as a larger, community effort, I think, again, there was an overwhelming want when the therapist who was presenting to our group mentioned what psychological first aid was. And so I think they would be open to it, but again, it's giving them that ability to recognize it in themselves, in their colleagues, and also in their clients. And so, again, it's a community effort. There's lots of people who are suffering, and if we tend to be problem solvers, just like our farmers. And so, if we can give them the tools to solve problems, I think they'd be more than willing to participate.
Maybe I'll break in here. We have a few questions that have been typed in, and I'll give Joe a chance to speak. This is a question about the county sheriff's office have hired trained psychologists to provide services, but it sounds like they're not those services aren't being availed by the population that's needed, which I imagine also would possibly similar to firefighters. Maybe you can comment on the challenges with that.
Right. It's that cultural issue. If you show any sense of vulnerability, can you be relied upon? Will you have my back when we're in a firefight in the fire service side of things, or if we're in a shootout from the law enforcement side of things, can I depend on you if I think you're not strong enough to handle the job? And so there's some cultural aspects to that. I'm sitting next to two distinguished women in their fields, and I haven't talked about the one thing in the fire service, and that's the infusion of women into the fire service and how that has changed the culture. Women are still the butt of hazing in the fire service. They're still, it's supposed to be the brotherhood. What are you doing in my firehouse kind of mentality. We're breaking those barriers down every day, but it still exists. And I think about the stressors that a lot of our female firefighters must be experiencing on a daily basis, and the need for support for them, not just the anti-bullying kinds of things, but also the mental health support to help them heal from the damage that may have occurred as a result of that hazing.
Okay, and I have one more, then I'll turn it back to the discussants, but this is a question for Stacey. Are veterinary schools doing anything to integrate training in their curriculum to help their graduates deal with this particular problem when they get out into their working lives?
Yes, they are. The National Association of Veterinary Colleges has considered this to be a major issue. Many colleges of veterinary medicine now have psychologists or social workers on staff to help their veterinary students deal with this. I don't believe there's been any formal analysis of the types of training that are most effective in things like this. There's a researcher, her name is Dr. Tracy Witt from Auburn University, who's looked at suicide rates in veterinary students and also veterinary technicians. And so there is some work that's going on, and it's certainly an issue that's on everyone's mind in the veterinary world. How can we train our students to be more resilient? But I'm not personally aware of any actual analysis to know what's the most effective training.
Bruce, if I can add something, I can't speak specific to the veterinary profession, but I teach farm and agribusiness management. And I think for any of our professions, any profession out there, I've started talking about it in my class, and talking about mental health, and talking about the importance of that, and understanding where you're at, and really addressing that and hitting it head on. And I started doing that in this last year because we haven't been addressing it. We dance around the elephant in the room, and we all just have to start talking about it more, and talking about, I look at it is that if you don't ask for help, that's a weakness. You're strong if you're asking for help and if you're addressing these issues, and that's where our thinking needs to go on this subject.
I strongly agree with Doris that awareness that there are resources out there, and having the conversation that it's just not me that's feeling this way. There are other people that are having reactions or having stress related to the career. Once you have that conversation, then it becomes more acceptable to seek help. And the other piece with that, though, is that in the fire service, we're finding that a lot of practitioners don't get it. They become so shocked by the story that they become vicariously traumatized themselves. When they hear about these incidents, and so the first responder chooses not to go back because they don't want to have to relive that tale again, telling their story because the therapist doesn't get it. So you need somebody who's really specialized in terms of understanding trauma and that moral injury piece.
Maybe I'll turn it back to Josie and Pat for a moment. Maybe I'll just make one comment to follow up on Doris's comment. We also, one of our other UMash partnership projects is with Carolyn Sheridan and Gear Up for Ag Safety, where they do all the traditional trainings. Carolyn's back there. Traditional training for keeping people safe and healthy in agriculture through colleges, and she is integrating a module to get them talking about and understanding the stress related and how to respond to it. So I'm glad you brought that up, Doris.
So one thing you all have talked about is the tremendous stigma that mental health has, and each of you have talked about ways that you're addressing it, unique to your circles of influence. If we take a step back for the general public health, how can we change the stigma towards mental health, do you think, in general, in the population?
If I had the answer to that, I'd be rich. I think it's pervasive. I think that from my social work background, and 39 years as a psychologist in the schools, people don't want to admit that they're vulnerable. Just acknowledging that for a parent, for example, when I would tell a parent that their son or daughter has an educational problem, it was stigmatizing. They don't understand it. What is a learning disability? What do you mean my child has a cognitive impairment? What is this ADHD business? They don't understand. So there's that fear about what does this mean for my life and for my family. And the same thing applies throughout any of these careers.
Well, I think part of it is that for some reason from the neck up, we treat that differently than the neck down. And we frankly have to get over ourselves. And I think talking about it and being brave and willing to talk about it and not dancing around the subject. I mentioned earlier that my husband has a brain tumor, and that causes, he has a lot of anxiety and depression because his pituitary is not releasing enough chemical, and some of you in the audience understand that a lot more than I do, but I see the outcome of it, and it took years for me to get him to actually go into the doctor and get help for that, get help for the actual imbalance and the anxiety and depression. And he was fearful that he would be on meds for the rest of his life. And he said, I don't want to be on meds. I don't want to be having to take something. And I said, listen, if you're going to be, have some sense of normality, if you're going to be able to operate, you need to do something about this. We have a daughter who's 14 who is type 1 diabetic. I said, you wouldn't tell Sarah not to take her insulin, right? That keeps her alive. Dealing with your mental health will keep you alive. And oftentimes we separate the two. Other body functions, it's fine if you have diabetes or if you have a heart disease or something like that and you need medication. That's cool in our society. But, head up, you're some kind of crazy person. And we have to get over that.
Yeah, I totally agree. That the only thing I would potentially add is we need to also look at the punishments that sometimes come along with a mental health diagnosis, because I am not a trained psychologist or anything, but I feel, and you can correct me if I'm wrong, that a lot of times, the things that, the general population go through are temporary. And, that label, in some situations, it actually comes with a legitimate cost. And at least in the veterinary world, a lot of times the fear of what can happen to your license, because a lot of times we self-medicate and then we develop substance abuse issues, and then you're down a road where you could potentially lose your license. So that just pushes you even further into the closet. So.
I agree. I think when we look at the economics of it, we're supposed to have mental health equity in terms of whether it's physical illness or mental health illness, you should be covered by your insurance. And we know that it just doesn't work. And we also know that the data, that sticks with you. If you have this on your insurance record as a pre-existing condition, what is that going to imply for you in later on a period of time in your life? So, yeah, there's a lot of work to be done. Some of it political, some of it economic. I wish I had the answer.
Well, and another thing that goes with it, when you have your own business, if you have your own veterinary practice or other small business, or in our case, a farm, and your lender gets wind of, oh, maybe you aren't operating on an even keel, you're a higher risk. And they can pull your loan. There goes your business. And so, you don't have the same protections that you might have through another job. If you're getting treatment for mental illness and you work at the University of Minnesota, there'd be big trouble if somebody pulled something. But there are ways to get around that out in the broader community, and that makes people vulnerable.
Did you have anything else, Josie? Okay, I think we've covered most of the questions that have been typed in, except for one that I'll just answer, which is, are there enough mental health professionals to serve these occupations, especially in greater Minnesota? The answer is no. And so we don't need to discuss that. That's a flat, there are not enough mental health practitioners in the country, let alone in the rural areas. But I think one thing that we like to also think about in the context of how do we address this problem is we talk a lot about in the Upper Midwest Agriculture Safety and Health Center of having a One Health approach to our problems, and where we have to do it on a multidisciplinary, cross-sectoral approach that engages different people addressing the problem at different areas. And this is a perfect example where type of problem where you need a multidisciplinary, cross-sectoral approach. I do see we do have a microphone. We can cycle around the audience. I know we're running late. I want to be respectful of the panel's time. Are you okay, or do you all need to be on the way? If there are any questions from the audience now that didn't type in, we'd be happy to hear them. Anybody?
I have a question. How much is known about the impact of these individual work-related stressors on family lives or community relations? I know it's a big question, but maybe awareness or knowledge of what happens beyond the individual himself or herself may help push this issue forward and perhaps get some resources that are needed.
I know in the fire service, we are part of your community, we do know that the incidence rates for alcoholism are higher in the fire service population than the general population. We know the divorce rates are higher in the fire service than they are in the general population. There's some data out there that supports this. So you're right. How do we harness all of the energy within the community to help support? And again, I go back to the fact that most of the fire service are volunteers. These are your neighbor, somebody down the street or down the road who's putting in their time. And so they're part of that family network. They're the support network within your own community. So we have to mobilize those resources. Absolutely.
I don't know if there's nothing specific to the veterinary world that's shown the impact, but just they're family members. They're a lot of times they're the breadwinners. When we did this survey, it was an anonymous survey, the survey that we did in 2014. And you have the fill in, put your comments here. Nobody ever fills those out. We were overwhelmed by the number of comments that people had. I got emails because it was the emails that in Minnesota we sent the survey link out to licensed veterinarians in Minnesota. Stories of family members who happen to still have their veterinarian's email address because it was part of the business. And I had a wife of a veterinarian who committed suicide, and she wrote this long email about how she couldn't believe that someone so smart would go down this road. And he was the owner of the practice. That was her family's livelihood. He had 3 boys. It was just heartbreaking. And I would be shocked if it didn't affect our families and our communities. But I just don't know how you could capture that.
Well, I think it very much does impact our families and our communities. That people that are involved in all of our professions are, I would hazard to guess, are pretty actively involved in our communities in multiple ways. I mean, my brother, when he was farming, was a volunteer firefighter, and responded to calls where there was deceased people that he had to deal with, in addition to the stress of the farm and things like that. The people that we work with are probably some of the more active people in the community, and that's maybe one of the problems. I mean, we support each other as much as we can, but there's a lot of people in the community that don't move in our circles, aren't the go-getters, aren't the problem solvers, organizers, whatever, and they don't know how to support those of us that are the ones that are out there doing the things. So we do the best job we can of supporting each other. I'll tell you one thing that's really disheartening, though, and it's a little bit hard for me to talk about, but when there was a young man who did a video a few weeks ago, and it went viral on Facebook, and he's a young man who farms with his parents down by Pine Island, and he was commenting about how tough it is to do the work, and how the CEO for Land O'Lakes contacted his mother and wrote her a letter and said that she could help her find a job. And he's saying she doesn't need another job. She's already working 18 hours a day, right? These people sometimes just don't get it. But then you read the comments in the Star Tribune from all of the people who are non-farmers, basically saying, it's your own fault. I'm not going to, and that you deserve this, that, labeling that everybody, you deserve this, you deserve the tariffs because you're the ones that voted in the current president, and on, and you're horrible people because you farm with livestock and these animals all should be free, and you get a belly full. It's like, really? We're not asking for handouts, but there's no appreciation for that connection to your food. And you're telling people basically to take a flying leap. And that gets really old after a while when you see message after message after message. And so a lot of people have just stopped looking at social media and stopped looking at comments because we don't feel that support necessarily from the community. And the bottom line is it's like, okay, what are you going to do when you don't have firefighters? What are you going to do when you don't have a veterinarian to take care of your animals that are so beloved? And what are you going to do when you don't have a farmer that provides your food?
That's very well said. I don't think I can top that, Doris. I would really like to... Oh, we have one more question back here?
So in getting the word out, I work with OSHA and I work with a lot of the groups in Wisconsin and try to put together meaningful seminars and presentations. Other than just talking that it's a problem, where would the next step be in getting things? I kind of like that, make food and talk about it and drink wine. That was kind of cool. But I don't think as a government organization I can sponsor one of those. But what would be the next step?
I would say for the fire service, we need data. We need information. Dr. Kim was talking about a survey that he would like to conduct of the fire service in the state of Minnesota. And getting sanctioned to do that has been an uphill battle for him. How are you going to fund it? How are you going to take, so data is good stuff. Having information, that's probably the first step for the fire service. But the veterinary folks, you've got a lot of data, so now how do you translate that into some kind of action step?
So, not to brag, but we had zero funding. It's a good bar story, actually. Randy Nett, who is a dear friend of mine, is married to a veterinarian, and he was switching jobs and was just appalled at the stories that his wife would say. And essentially, he got together about all the vets that he knew in public health and we called in favors, and he knew Tracy Witt from Auburn, and so it was one of those things where like the stars aligned, and we cashed in all of our favors with our networks, and we were able to do it. And once we did that, that's when people started talking. That's when AVMA paid attention, and we published an article in the Mortality and Morbidity Weekly Report, the MMWR, and it made national news. Like, you guys just like puppies. I mean, why are you sad? So, and he is lucky that he's in a position at NIOSH where they're able, they have access to data. But even Suzanne's study, again, absolutely no funding. She did that as, a project, and they're trying, but it's hard, and sometimes you have to do it in order, and then the money shows up. But I think just talking about it, and networking, and just, if you know people who have, at MVMA, sorry, I just talked, we're still struggling to figure out what we're going to do here in Minnesota to be supportive. But we had a panel of veterinarians that, people respect, and, they just opened up, like, how do we do work-life balance and things like that. And unbeknownst to me, I gathered them because A, I knew them, or B, they had a good reputation. All of them had sought help at some point in time, and they all got up and admitted it, and with no prompting, and that just opened the floodgates. And so I think, again, just talking about it and getting people to realize that they're not alone is so important.
I guess I joked with Bruce earlier. I said to him, that Megan and I work cheap. So, in agriculture, we tend to be problem solvers, and we're looking for things. And, what we found is that people were wringing their hands and saying, "Oh, there's a crisis," but they're not doing any. They weren't doing anything to speak of. I will say Minnesota has done an outstanding job, though. UMass, Minnesota Department of Ag, several other organizations really getting together and getting out in front of things. And kudos to you for taking the lead. But for a lot of people around the nation, a lot of hand-wringing. And we just decided, we started talking last June when you had your forum on cultivating resilient ag communities. Notice there's a connection on the theme of your project and ours, that we really wanted to do something. We had talked, I had been bringing this up at national meetings for 4 years about farm stress and ag stress, and no one would listen to me. Major national ag organizations were just turning, blind eye. They just didn't want to talk about it, stick your head in the sand. And we just thought we'd start doing something. And doing something is better than doing nothing. We didn't have the research. We had a lot of anecdotal evidence. We didn't have research, but we thought, okay, well, if we start doing something and do research simultaneously, then we can start gathering information. And from that, now that research, we haven't distilled all of the data down, but we're looking at that, to inform what we're going to do in the future. But there's lots of things. I mean, I've got a whole long list. I'm writing up proposals now, but we're really expanding our work, and we're seeing the evidence is from both Canada and the United States that we have a lot of work to do. So if you know where there's money, we'd be happy to accept it. And a lot of the things that we're doing as volunteers. I do more volunteer work in agriculture than I do paid work. And that's the case with a lot of us because we believe in this.
One of the things that I'm kicking around with University of River Falls is, and they've worked with insurance companies, and there's a lot of insurance carriers that do farm policies that are interested in, kind of that. And we talked and kicked around regional, so people don't have to travel, and get it kind of down to that community level. So looking for support, there's a lot of support in the insurance carriers.
Okay. Well, I think we've had a great discussion today, and I want to thank our panelists and discussants again one more time. It's been a It's been, I think what this tells us is this is clearly a problem in the occupations we've talked about here. Many other occupations that have stressors that relate to their jobs that end up manifesting themselves as disease, mental health disease. And so we need to be thinking about this going forward, that yes, it is an occupational condition. How do we approach this? How do we address the problem from many different ways? There's not going to be a single magic bullet to fix this in any occupation, let alone one. And so I really applaud the work of the people that are doing the work they're doing and trying to move this into a better place. So thank you all for coming, and I believe there's still some more treats out there, and take care.